All right, so as Texas fights a rise in COVID-19 cases, the Department of Defense deploying 580 military, medical, and support personnel to help out. Here with an inside look on the grounds is Texas ER Dr. Natasha Kathuria. Doctor, thanks for joining us. What cities have you seen, and what information can you relay?
So I work in Austin, and I work sometimes in Houston and in New Braunfels, which is outside of San Antonio. And, between all those cities, and I have colleagues kind of across Texas, things are getting busy everywhere. In every main city in Texas, we are stretching. Our ERs are stretching, our ICUs are bulging at the seams, and things are getting very, very busy, even with normal ER patients, let alone all the COVID patients which are coming in. So it's been very terrifying. Even the patients that come in for non-COVID related things, like a trauma patient, for example, we end up finding out that they have COVID while they're in the ER. And so things get very, very hectic at that point because these are infectious, communicable diseases that we very much worry about.
So if someone tests positive, they don't go for hospitalization unless they begin to fail, correct?
Correct. Yeah. If somebody comes into the hospital, we're not testing them unless they need to be admitted. But as you can imagine, a lot of trauma patients, a lot of pre-surgical patients, a lot of patients that are being admitted for other things will need imaging. And on that imaging, we might see, oh my gosh, they have COVID in their lungs. Now we have to really attack this whole situation very differently.
So I understand Houston is so bad, the mayor there is calling for another lockdown. How bad is it in Houston? I heard a week ago they were running out of ICU beds.
Things are pretty bad in Houston right now. I mean, they're working on bed management. They're stretching. They're at their limit. Some hospitals are already well past that limit, where they're trying to shift patients between hospitals to make room. They have to keep these patients in certain areas. They can't just admit a COVID positive patient anywhere. So it's been very difficult. I mean, they're even having to use the children's hospital for backup for adult patients, which, I mean, that's pretty remarkable. That's a red flag.
I watched Admiral Giroir over the weekend. He says the main difference is from now in the spring is you know so much more about it. The ventilators are really a last step now because so few recover from it, and remdesivir has been effective. What can you tell me has been effective, and are people recovering?
Oh, absolutely. Our management has changed of this disease. We've learned so much about it. We are intubating patients later. We're using blood thinners. We are using remdesivir when hospitals have it. Not every patient will have access to that medication. They're very strict guidelines on when we can start it. Our management overall has changed, I mean, with any new infectious disease as you go along through the course. So we're better at managing it in these patients, and we are doing a better job in getting more patients across the finish line. But what we're worried about right now is the collateral damage. When you overwhelm a healthcare system with anything, especially an infectious disease like we are right now, you don't just worry about the patients dying from COVID, then it's patients dying of completely otherwise preventable causes of death. Appendicitis, heart attacks, strokes, everything gets affected when a healthcare system's overwhelmed. And the mortality of all of that has to be included when we look at our moral compass of how much we're willing to sacrifice and tolerate before we step in.
Okay, and real quick, anything else that you need? Because they are responding. Are you looking for more pop-up hospitals, tents, conversion of stadiums?
I think right now we have backup plans in place around the city in every city, I know in San Antonio as well. But we don't want to get to that point where we're outside of the hospital. As you can imagine, you don't have access to everything else the hospital has, the radiology, the blood work, everything else gets transferred. So we're really working on personnel right now, healthcare workers, frontline nurses, respiratory therapists. That's really what our manpower is. Our physician staffing is okay right now, but that's teetering. We'll see how that goes, but it's really the nurses and the respiratory therapists. We're already surge staffing from around the state. So we'll see how much we can handle before, this blows out of control.
Dr. Kathuria, thanks so much. We'll look forward to checking with you again, hopefully this week.
Definitely. Thank you.
And have better news.